How'd that feel?
Great. It's an amazing feeling. It actually is.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now the main complaint is shoulder pain, correct?
That's right.
Okay, and it's in both shoulders?
Yes.
Okay, and then it's also, you're kind of feeling pain coming from here and going down like this, correct?
Yes.
Okay, how long has this been going on for?
For a while now.
For a while?
Yeah.
Okay, and then for work, what do you do for work?
I'm a forklift operator.
Forklift operator. So okay, you're moving, kind of arms up. Obviously, you're controlling.
Yeah.
Okay.
Getting off the lift, getting heavy boxes. You know.
Okay. Okay. What I want to do today, I really kind of want to get a baseline of where everything is at. So I'm going to put you through some ranges of motion, and then we're going to do some orthopedic tests. Now, in the shoulders, what kind of pain do you feel? Does the pain stay in the shoulders, or do you
kind of like right here on the shoulder blade?
In the okay, right into there. Okay. Do you notice any loss of range of motion if you're to move your arms around, bring them up? Do you notice any tightness or?
No, just like a little bit tight right here.
Okay. All right. So what I want you to do, first off, I'm going to have you look all the way up at the ceiling for me. Any pain with that?
No, but it feels a little bit stiff.
A little stiff. Okay. And then look all the way down at the ground. Any pain with that?
A little bit, but it just feels like it's pulling.
That is pulling. Okay. And then I want you to bring one ear to one shoulder and then to the other side. Any issues with either of that?
It's like tight.
Tight? Okay. And then I want you to look over either shoulder. Nothing really tight with that?
Yeah.
Okay. So now I want you to remember that, because after we do the adjustment, we're going to go through the same thing. I'm going to put you through the range of motion again, and let me know if anything does change, obviously, from before and after.
Okay.
Yeah, I want to see you bring your arms out by your side like that. If I'm going to push down, don't let me. Any pain with that?
Yeah.
Okay, and through here?
Yeah.
Okay. All right, so a little bit of pain when I push down. Now, granted, I'm not using a lot of force or weight or anything, so just lightly. Okay. Sit up nice and straight for me. Good. I'm going to push down on the top of your head. Any pain with that?
Yeah.
Where at?
Right up here.
Right into here? Okay. I'm going to turn to the side. Any pain with that?
Yeah. Already.
Okay, and then we're going to go to this side. Any pain with that?
Same.
Same over there? Okay. Now I'm going to lift up. Any increase or decrease pain?
A little bit of decrease.
A little bit decrease? Okay, good. And then we're going to just decompress and push here. Any pain with that?
Right here.
Right in there? Okay. And then same thing with this side?
Yeah.
Same over there? Okay. Alright, so we just went through just some range of motion, just some orthopedic tests, just kind of seeing where baseline where he's at. So we're getting a little bit of pain and stiffness, tightness in all the ranges of motion. Some positive orthopedic tests, with the compression, and then obviously even with the distraction as well, in a good way because he was getting release. Now that pain's going down through here. Have you been adjusted before?
No.
First time ever being adjusted?
Yeah.
Okay. So we've got a first time chiropractic patient here. Nice to know that he is from the area, local, so that's always a good thing, having people in the area, so it's easy to actually follow up and see you again for second or third visit. But today, let's go ahead and start. Now, because I know it's your first time, I'll kind of go over a little bit. The noises that you're going to hear, it's just gases that are being released from the joint. Now, granted, if you hear cracking of your knuckles, the only difference, for one thing, in here in your neck is it's a lot closer to your ear, so the noise is going to be a lot louder, okay? But when we go ahead and when we make those adjustments, what I'm doing, here I want to show you real quick, just because you've never experienced this before, or really have probably that knowledgeable of a background, but what I'm doing and what a chiropractor is doing is we want to take pressure off the nerves to allow your body to heal and function as it should. So if there's any pressure being put on the nerves, where in your case, when we were doing those orthopedic tests, especially in this upper cervical area, we were getting positive indicators that there is some type of irritation on the nerves. So what I'm going to be doing through the rest of the adjustment and the kind of the preparation to the adjustment is we're going to see what areas need it, and then we're going to, with the chiropractic adjustments, we're going to remove that pressure, and like I said, you may hear popping with that. And from there, we're going to allow your body to start to function and heal as it should. So, let's go ahead and get started. I'm going to have you lay face down for me. And I'm going to have you, let me have your, we're going to bring your arms, yep, right there. Perfect. So as we like to start every adjustment, we're going to scan the entire body. So we're going to start all the way up in the occiput, and we're going to palpate as well. We're checking that right side to the left side. You know, we're looking for the symmetry, feeling for any tight, you know, tender nodules, any taut fibers, you know, in the back where I already know when he was sitting up, his traps on either side were both a little bit kind of like inflamed, a little bit tight and pulling. So we are going to use that massage device in a moment here. But let me know if any of this is like sore or tender when I push in, okay? Any pain in here? Oh, good. Okay, just a little tightness, a little bit more on the left than the, well, actually no, they're both about the same. Tighten throughout the traps. So we go from that cervical spine into the thoracic. How's that feeling? Okay. From the thoracic, we go through that upper back, middle back. Now we're coming into the lower back, that upper lumbar vertebra. And then through here. Any pain in through here? No. Good. And then we're coming down to the sacrum, into the SI joints. So if I push in over the right side, any pain with that? Any pain directly over the sacrum? Or any pain on the left side? Okay, good. So we're going to come all the way down, we're going to check out the leg length here. So when we bring the feet together, as you can tell, the right leg is pulling short. So we're going to recheck that after we go ahead and do some adjustments. Now, what I was feeling, we're definitely getting some tightness right in through here, just like this. So what we're going to do the massage device. We want to relax the areas in through here before we go ahead and make that adjustment today. So we are going to do the Hypervolt is the portable massage device that I like to use. It tickles down there. Perfect. How'd that feel? Good. Until I got a little bit lower there, it started tickling. But yeah, no, that little thing is pretty powerful, which that's why I like using it. But all right, let's go ahead and we're going to start with the adjustments. I always like to start at that cervical thoracic junction there. So we're going to make that first adjustment right up here. So now, like I was telling you, it may be, loud pops and cracks that you're going to hear, okay? Mm-hmm. Okay, so we're going to start with that T1 on the left. Good. Not too bad, right? Mm-hmm. Drop down to T2 on the right. There it was. Good. Okay, so we're going to go and do the upper back, that upper thoracic adjustment here. So I'm going to have you take a deep breath in and exhale all the way out. Good. Drop down a little bit here. Take a deep breath in and exhale all the way out. Good. I'm gonna go one more time, a little bit lower here. Deep breath in and out. Good. Okay. So now I want to come all the way back down. Recheck that leg length here. So even just with that, it's almost good. It's almost perfect. So we started off right short, and now even just with, we did the that cervical thoracic, you know, like the T1 and T2 adjustment here. We did that upper thoracic and that upper back, and then we did a mid thoracic, a mid back adjustment as well. So he's been in the prone position, so we've been doing the P to A, meaning posterior to anterior adjustment. What I want to do now is I want to just check the sacrum, see if there's any issues down here. So I know you weren't having any pain down here, but it's just something that I like to check. So I'm going to stabilize on the sacrum. I want you to raise this leg up as high as you can for me. I want you to raise it up relaxed. Not like that, but like that.
Oh, okay.
Okay? So let me stabilize. Yep, raise that leg up for me as high as you can. Any pain, tenderness with that?
Yes.
Yeah?
Yeah.
Okay, relax. Now raise the left side. How does that side compare to the other?
This one was a little bit harder.
That one? Okay. Yeah, and when you were raising it, I could tell like it didn't want to raise as quickly as this side. This was a little bit, it seemed like you were struggling a little bit more. So what I'm going to have you do, well first I kind of want to tell you how the table works. So the table is going to come up from below just like that, and I'm going to be doing drops and bringing it down, okay?
Okay.
Okay, so I'm going to have you cross this foot over that foot for me, good. Now, so what's going on, here I want to show you so you kind of understand a little bit. What's going on, do you see how your right leg was a little bit harder for you to raise up compared to the left? So what's happening is the sacrum here, this is where I was stabilizing, was right here in the sacrum. What it's doing is it's pointing more towards the left side. So it's easier for you to raise that left leg up compared to the right. So what I'm going to do is I'm going to do drops, because you felt how that table comes up below you. So I'm going to do drops, and I'm going to torque it, put a counterclockwise torque, so we can spin it back more towards midline. And then I'm going to recheck, and then you can tell me what you notice as a difference. Okay. So we're going to do that P to A drop, posterior to anterior, and we're going to do a counterclockwise torque. Good. Uncross. And now I'm going to have you just bend this knee for me. Yep, just like that. There we go. Good. So now when I come back here, I'll stabilize again. Raise this side up for me. Do you notice a difference?
Yes.
Was it easier to raise?
Oh yeah, this time it was.
Good. That's exactly what I was looking for. So I'm going to come back down here as well. I'm going to recheck that leg length. As you can tell, spot on perfect. It's exactly what we needed. Good, so we had just a slight misalignment on that sacrum there, which is a good thing. So what I'm going to have you do, I'm going to have you sit up for me. Okay, and I'm going to have you stand up, take a couple steps forward. So because your main issue is really right through here, going down, I'm going to do a standing, it's called an intercostal adjustment. So I'm going to have you bring your arms out by your side like that, good. I'm going to come up and around like this. I want you to put your hands over mine. Yep. So I'm going to lean you back onto me, trust fall on me, squeeze your elbows together. Good. Relax. Alright, so that part was already cleared out, which is good. So I'm going to have you take a seat right here for me. Yep, face that way. So I want to make sure that we have this thoracic spine nice and cleared out. When I mean cleared out, I mean we want to get as much pressure off the nerves as we can before we go ahead and do that Y-strap adjustment. Okay. So I'm going to have you give yourself a big hug here. Good. Okay. So with this, what I'm going to have you do, I'm going to have you take a deep breath in, then I'm going to start bringing you down on the table. As I bring you down, exhale all the way out, okay? Yep, deep breath in, and out. Good, 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 good. There it was. Perfect. Relax right there for me. Good. So now, we're going to do the Y-strap. Now this is the main reason on why people come to see me, is because of the Y-strap. So now, after I go ahead and do this adjustment, you remember how you were feeling before when you were doing the range of motion, how things were tight, a little bit of pain, a little stiffness. After we use the Y-strap, we're going to put you through those ranges of motion. Let me know how things are feeling again, okay? So lift your head up and relax. So now we have not only a first-time Y-strap, but first-time chiropractic patient in general. How has everything been so far?
It's great. Everything's been feeling good.
Good, good. All right. So here we go with the Y-strap, and just relax. There we go. And just relax for a moment. How'd that feel?
Great.
How, here, let's bring you up. Alright, good. Turn and face that way. How would you describe that to somebody who's never had that Y-strap before?
It's an amazing feeling. It actually is.
Now you felt how that just like pulled apart
Yeah,
the
like
decompress.
everything.
Yeah, just let everything go there.
Yeah.
Alright, so now even right after we did that, I want you to look up, look down, look to the left, look to the right. How are things feeling?
A lot.
Do you notice a difference? Not like from when you first came in, just doing those little movements.
Oh, it's a lot. You could tell like less tense, like less.
Good.
Yeah.
Good. That's exactly one of the main things and the main reasons on why people, you know, they need that adjustment. You know, that was just obviously one time, first time ever being adjusted, and even that quickly, just even, you know, the tension has let up. Now, granted, a good thing, you know, everyone is a little bit different. It's not like you came in with like crazy or very advanced problems or serious issues. I know for you it was really tightness, stiffness, a little bit of pain through here. But even just with that one adjustment, I know that.
Oh, I feel great now.
You feel great.
I feel great.
You feel great, and that's the whole point. You know, that's how it should be. This is, as you guys can tell who watch my videos, the reaction I get between patients, it's because, you know, when after you get that adjustment, it's like, oh my gosh, you feel great. And everyone that I've adjusted, you know, they feel great after the adjustment. They get up, they leave, and they're, you know, from how you came in to how now you're going to be leaving.
It feels less stressful.
Less stressful, and that's the whole point. Perfect. Well, I'm Dr. Joseph Cipriano. If anyone is looking to ever schedule an adjustment, send me a message. Go right to drjosephcipriano.com. Typically, I'll respond within 1 to 2 days. And one thing to look forward to, you know, I still have that December, you know, with Christmas, the giveaway that we're doing. And then I do want everyone to know that January we are going to be having another giveaway as well. So make sure you guys kind of tune in and, you know, turn the bells on and subscribe to the page, just because we are going to be doing and going through a lot more giveaways. So I want to make sure that all the viewers out there, you guys are at least watching and knowing when and what videos to watch. And, you know, I don't want anybody to miss anything. I'm Dr. Joseph Cipriano. Have a good one, everybody.